Are you a sports physical therapist interested in working with more athletes, but you're concerned about where do I start, or am I even on the right path? That's what we're going to be covering inside this video. My name is Dr. Chris Garcia. I help sports physical therapists improve clinical outcomes and increase patient satisfaction. When you think of a sports physical therapist, you might think of a person who does really high-end corrective exercises. Maybe they know how to mobilize really well, great manual skills, and they work with more athletes. Now, what I'm going to share in this video have nothing to do with those qualities. What we're going to be covering today are three critical pillars that every sports PT should have in their arsenal. It separates average from elite sports physical therapists. The first quality is being able to understand acute injury management. Now, you don't have to be an athletic trainer to understand these timelines, but you do need to understand the basics and fundamentals to be able to help a patient who has gotten off the field and has an acute ankle sprain, and your ability to get them back to sport is critical. Most physical therapists are stuck between 4 weeks to 16 weeks after injury, and that's purely because of insurance limitations. They may go to an urgent care, they might get x-rays, see their primary, maybe see an ortho, and that takes 3 to 4 weeks before they can finally see you. Now, if you understand acute injury management, you can see those patients or those athletes in a high school setting, in a college setting, or maybe even in club sports. That allows you a gateway to be able to help these people immediately versus only having to wait until after they've gone through the system. Now, the question is, do you feel that you have those skills to manage those injuries? Because a lot of physical therapists will see these athletes and they go to take a CEU course, but they still feel stuck. Like even if they came into the office 2 days after a shoulder dislocation, would you feel comfortable guiding them through that process? Now, if you saw them 4 weeks after when they're under control and their pain is managed, of course it's easy. They've already been set up for you. Now, if you see them 2 to 3 days or even on site, would you be able to manage that? That is one crucial pillar of a successful sports PT. And if you don't have those skills, you need to acquire them. Number 2 is being able to program for athletes. True strength and conditioning principles. If you're unable to currently do that, you're going to struggle with athletes. And I'm not talking about end stage rehab where they're near discharge and simply you don't have the confidence to continue programming. So what you do is you just add more exercises onto their current HEP, and then you add more parameters. Like you add another set, maybe add some resistance, add 5 more pounds, just make it more difficult. Go on a BOSU. That is not strength and conditioning. Strength and conditioning is understanding an athlete's year and then breaking those down into quarters and then breaking those down into months and then breaking those down into weeks and then day by day gains to be able to help them get to their sport. And physical therapists, what we're really good at from traditional insurance-based ortho physical therapy is designing a home program based on the way a patient presents. That is a forward-thinking strength program design versus true strength and conditioning is looking at a year from now and working backwards and creating a program to accommodate and achieve a goal. So if you're still stuck at week by week programming, adding in a couple reps, adding in a BOSU ball, making it more challenging, adding single leg balance on an RX, that is not strength and conditioning. That is perfect for general population or community members, but not higher level athletes. So you're going to need to know acute injury management and true strength and conditioning programming. And the last thing, the last quality, is probably one of the hardest ones that physical therapists struggle with, and that's being a team player. You might say, well, I work with doctors and athletic trainers and other individuals regularly. You do, only when it's convenient because you're so saturated. Being a team player is being fully immersed and being vulnerable to say, I'm not sure where I fit in and trying to figure out the best route. Physical therapists, because maybe you have an advanced degree, you feel like the white coat puts you in a good position to be successful and everybody should understand what you do and how you do it. Now, as a physical therapist in the sports medicine world, you're probably at the bottom tier. Why? Because you've never been placed in that situation. Now, to work with athletic trainers who've been doing this, now massage therapists who've been doing this, other physical therapists, maybe even a chiropractor or other healthcare providers, people who've been doing this for years will help you understand. And the best thing you can do is come in and being open to that and being vulnerable and saying, I'm not familiar here. This is new to me, but I will learn fast. And your ability to navigate from the bottom up will be so fast, so efficient. But the challenge is most physical therapists have a challenge with communicating purely because of the logistics of the system. You're not used to communicating with an athletic trainer, primary care physician, the nurse practitioner, or a dietitian on a regular basis and planning and forecasting for somebody's success. You're used to, this is my current problem. I only need help for this timeline. They're going to be discharged in 4 weeks and they're out. For you, it's a short timeline that you manage people, 4 weeks to 4 months. Now, when you work with higher level athletes and as a sports physical therapist, you're going to be working with people for up to 1, 2, 3, 4 years, and your ability to navigate those challenges are very different than what you currently have. So if you're looking to be successful, you need these 3 pillars. Number 1, acute injury management. Number 2, strengthening program design. And number 3, being an absolute team player in a multidisciplinary setting. If you're stuck and you're thinking about what do I need to do next, these are the 3 that I would highly recommend to improve your practice and become that sports PT that you've always wanted to. Enjoy. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on treating cash pay patients, becoming that expert in your community, and thriving in business. Thanks, and I'll see you soon.